Hi, my name is Dr. Jamie Copper, and I am one of the internists here at Iowa State University on our equine internal medicine team. I'm here just to talk to you briefly about our waterbed. So this was mentioned in our recent post on equine herpes virus 1 and the EHM outbreak and raised a few questions, and we thought it would be a great opportunity to talk to you all about it. So this waterbed was custom made for us here at Iowa State University, and it is designed such that it is big enough to not only allow a full-size horse, as demonstrated here with our model horse, Winnie, to lay on, but also to allow us to change recumbencies or to flip them back and forth without having to move the bed to improve our ability to care for down horses. Certainly it's not for every case and every horse, but there are a couple of advantages to using it that we have found to be beneficial. So some of the problems that occur when you have a horse that's down, usually due to neurologic disease and is unable to get back up again, are secondary complications. So just due to their sheer size and weight, that can result in some pretty significant damage to their skin and integument. So they will get ulcers and decubital ulcers in a really brief period of time that can lead to a lot of complications, both with the skin itself as well as underlying muscle and joints. Additionally, due to their weight, they can get and result in secondary muscle crush injury. So just being down and on their muscles all of the time, that can lead to injury of their muscle. Next, we can also see secondary nerve injury to them. So if you think about if you've been sitting down in sometimes kind of an odd position for too long, when you go to move, your leg gets all tingly and it doesn't work quite right for a minute or two until the blood flow gets restored back to it again. We see that same thing in our horses that are down and unable to get back up. And so then when we try and get them back up and assist them to stand, either with ourselves or with our slings, not only do they have their initial problem that resulted in them being down to begin with, but we also have secondary issues with their muscles and their nerves that is making it more challenging for them to get back up again. Finally, a lot of horses really struggle with being down. So even though they can't get back up again, they're prey animals. They want to be back up, and so they may be struggling a lot unproductively to get back up and kind of thrashing around. And that can lead to complications as well. So they can either injure themselves in doing that and sort of throwing their bodies around, and then they can also really tire themselves out. And so when it is time to make a good attempt with a sling to get back up again, they're just too tired from all of those other unproductive attempts to make a really good, solid effort. And a lot of those horses do better on the bed, and they do a lot less thrashing and moving around, and it seems to really help calm them down. And so those are some of the reasons that have led to us using it here, and have enjoyed using it for a lot of our patients and found it to be helpful. Certainly it's not for every patient, so not every horse is a good candidate for it, but is a unique tool that we have here that can help us provide elevated care for down horses and trying to get them back up again.